As I mentioned earlier, gun violence has received less than 1% of the research funding that any other similar leading cause of death in history has ever received. And as a result, we know very little about what we should do to prevent gun violence. There are strategies that are evidence-based, but we just have so many gaps in our knowledge. And I'll give you a few examples. We don't even have good gun data, right? If you look at how we changed the paradigm on motor vehicle safety, it came by the CDC having better data on motor vehicle accidents. That's what informed research around seatbelts. We don't have similar data for guns. And we as a healthcare industry need to change that, otherwise no one is going to. Policy. We often view policy as political. It's not, right? We know, again, seatbelts, tobacco age limits, these are things that are part of a public health approach. Academics have not dived into researching this with the same rigor as they have with other things. We need to do that to be able to, again, support advocates like Manny and Adriana in the work that they do. And then, just very broadly, implementation. So this is where I'll get to ERPO. Adriana mentioned, for example, there's something called the Extreme Risk Protection Order, or red flag laws, that allow family members to petition for temporary restriction of weapons from loved ones who might be at risk of harm to self or others. But the interesting thing there is that we've poured millions of dollars into policies like this, but they're very rarely implemented. So in New York State, for example, 98% of these laws are actually implemented in Suffolk County, part of Long Island. The rest of the state, they're barely implemented at all. These are laws that have been shown that if you implement 10 to 11 of them, you can save one life. To put that in perspective, colonoscopies, prostate cancer screening, those screenings that we do in the other healthcare realm, you need to do 100 to 200 of those tests to save one life, versus an ERPO law, you need to do 10 to 11 and you can save a life, but they're barely implemented. And the same goes to say for the hard policies that folks on the stage here have fought for, like safe storage laws and so on. So we need to do a better job of implementing those actual laws. I will say the petitioner pool for red flag laws extends to physicians in some states, teachers, and other folks. So as a healthcare industry, it's actually something that is very much in our purview to be able to educate families on or to petition on their behalf, because we know that it's not always easy for a family member to do so. So we have a responsibility to do that. And the last thing about implementation that I report is, as everyone mentioned here, safe storage counseling, gun laws, violence prevention programs through hospitals. These are evidence-based things, but again, we know that only 8 to 10% of healthcare providers across the country for the last 10 years ever asked about firearm safety or screen or intervene. So we need to change that. We've been waiting for decades. We haven't changed it. Manny, Adriana, I think we hear you loud and clear, and we need to continue to amplify these efforts.